year later, 1 year later, and I feel like I have two perfectly good legs and knees and ankle. Everything's like I was when I was 30. That's extraordinary to me. Yeah, my name is Greg Sterling. I currently live in Vancouver, Canada. I fell off a waterfall when I was 19 and hyperextended the knee and just severed the PCL ligament, and continued to race motocross for another 15 years after that. So I had a meniscal, it wasn't a repair, it was where they trim away the meniscus. And I lived with that until I was about 60 years old. I'm 62 now. And even after years of running and everything else, it seemed to hold out. But when it went, and I got to be bone on bone and collapsed on the medial side. And it became impossible to even walk a block without being in pain. So I went from one day being able to bike and elliptical and walk to literally a week later where I felt like I was crippled. And it was probably going skiing with my sons that did me in, and that's when it just literally became very painful. I lived with that for 2 years, and I saw every kind of doctor I could see in Canada. Nobody seemed to give me a solution that was reasonable to me. One of them wanted to do an osteotomy, which is they cut the bone and try to straighten your gait out so you're not bow-legged anymore. That just seemed barbaric. The other doctor said, just wait another 5 years, we'll do a full knee replacement. And I thought, I can't live with this for 5 years. I'm 60, I have teenage children, I want to run around with them, I want to live life with them. And I was so frustrated, so I went to, like everybody, I went to the internet and started looking for knee replacements. I saw doctors that were injecting to deal with the pain so you could walk around still injured, but you didn't feel the pain. I thought, well, maybe that's a solution. Eventually, I don't know how long it took, but I got to find the Stone Clinic. And oddly enough, I listened to a couple of patients, just like what I'm doing now, and when I listened to what they had to say, how they had been athletic all their life, how they had had a repair, a reconstruction of some sort, and how they got back to doing what they loved, I was like, wow, this is either too good to be true, or I need to go check it out. And I live in Vancouver, it's a 2-hour flight, I came to check it out. Luckily I did. It changed my life. It really changed my life. So I think once I realized that there was something beyond or more progressive or more advanced than a full knee replacement, and I saw that, hey, there's a lot of other options here. I did look at doctors in, I think, Chicago and also in Miami. I never went to visit them. I think once I got on the phone with Dr. Stone, I just had such a good sense. I mean, it's the kind of guy that you leave going, God, I'm glad he went to medical school. In Canada, we do have socialized medicine, and they do everything they can to sort of not have to go into surgery. And if you do go into surgery, it's a long wait time. I couldn't put up with it any longer. After 2 years of messing around in the Canadian system, I just thought, enough's enough, I gotta go. And oddly enough, when so I got my MRI, I got my x-ray, had the consultation on the phone with Dr. Stone, and I got a good sense that he knew exactly what needed to be done. When I came down here, the twist in the story is that my knee was actually farther gone than the MRI probably showed, and he said, look, we can do the bio replacement on you, but it'll probably give you 2-3 years. If we do a partial knee replacement, it's a whole new ball game. And I trusted him, and that's part of what makes this so special, is that when you put your trust into somebody and they really deliver, it just, it takes the weight of the world off your shoulders, and you take a sigh of relief, and you're like, wow, I got my life back. So I came down here, and he literally told me that on I guess a Tuesday. I went that afternoon for a CAT scan. The Wednesday I did my surgery, and I stayed down for a week to go to what is really world-class physiotherapy. And within, I guess, 2-3 weeks, I'm off crutches. Within a couple of months, I'm walking around fairly normally again. I'm back at doing the elliptical, back on the bike. I take it nice and slow, and now I'm 1 year later, and I feel like I have two perfectly good legs and knees and ankle. Everything's like I was when I was 30. That's extraordinary to me. The biggest challenge when you have a knee surgery, I think, is the atrophy. You lose your muscle tone, but they're so good to get you back, like almost right away, back on a bike within 24 hours, 36 hours, to try to minimize that atrophy. And so I was aware of that. So getting the bone, or not the bone, but getting the muscle strength back in the legs was the long-term thing. And that took, for me, probably 10, 11 months. I feel like now I'm almost there. I'm about 95% of my left leg compared to my right leg. My right leg, I think, got very strong through the recovery because, you're doing both legs, but, you are working out a lot just as part of your rehab. So the good leg gets stronger while the left leg has to, in my case, the left leg has to catch up, but it does. The emotional part of it, or the psychological part of it, ultimately you have to have 100% trust in your doctor. I mean, obviously you're putting your life in his hands, and I was able to do that. Like when you meet somebody you really think is gifted, it makes it a lot easier to do that. If you have any doubt in your mind with a doctor and it doesn't feel right, you probably shouldn't do it. That's, to me, a huge part of the Stone Clinic is that I came down here and I felt like, wow, I really see that these guys are special at what they do, and I trust it completely. And so, I came out of surgery singing.